Hello everyone, my name is Akang Shrinani, and welcome to my YouTube channel Neuro Chat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism spectrum disorder, and more. On the channel, I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists, seeking their views and updates on their latest work, research, etc. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. Dr. King is an expert in numerous aspects of health, law, policies, and reforms, advocating for the access to affordable and equitable healthcare. Her research focuses on healthcare costs and transparency in healthcare pricing. She has testified before members of the U.S. House of Representatives and several state legislatures, and serves on a technical expertise panel for the Assistant Secretary for Planning and Evaluation for the U.S. Department of Health and Human Services. Dr. King co-founded the Source on Healthcare Price and Competition, a website designed to provide academic literature, court documents, regulatory and legislative materials, news, and analysis on healthcare price and competition. Dr. King, welcome and thank you very much for the time today. At the onset, could you please tell us a bit more about how your work intersects with law and public policy?
Sure. Thanks so much for having me. I'm delighted to chat with you. So I think that, my work, I'm a law professor, and so all of my work has always sort of been focused on the ways that law and public policy can be used as tools to really promote health. And in some instances, this means designing new legislation or shifting the way that we're interpreting legislation through different types of regulations to make the law work better to improve health. And in other instances, it might mean removing legal barriers that exist that might impede health in certain situations. And so really always looking at the role that law is playing and can play in the promotion of individual health. And so just thinking of it more as a tool as opposed to, a boundary or a constraint.
Thank you very much. And how do you ensure that your research informs and influences policymaking effectively?
Thanks. It's a really good question, and it's something that I try to always keep top of mind because I always want to make sure that my research is sort of aimed at moving the needle and driving change. And so when I design research questions, I try to do it with the goal of what kind of legal or policy change would make this possible. And so it's always really important in that space to when you start with the question, to really go out into the community to hear from people, what are the challenges that they're having related to this problem? How is this working on the ground? And then think through sort of the legal and policy options that might be able to facilitate that. So one of my research projects looked at why healthcare prices were so difficult to figure out what they were, to actually even identify them, even for the physicians whose services were being charged out, or for patients. And it turned out that there were trade secrets protections being claimed, or there were gag clauses being put in contracts. And so that's ways that the law was really being used to inhibit information. And so what are the different ways that you can use law to sort of remove it and make arguments from a legal and policy frame about how you want to drive that change. And so I think it's really about the way that you ask the questions, the kinds of policy and legal responses you propose, and then moving your work beyond what's happening in the academy. You're not just writing a paper for other legal scholars, you're actually taking it out to policymakers, legislators, and the public to say, this is how we should do it differently. And sometimes that means putting work out there in different kinds of formats. So not just into legal academic literature, but into blogs, into policy briefs, and trying to get it out into the hands of people who can actually make that change.
Awesome. Thank you so much. And ask what some of the key legal and policy challenges you've seen and see in the field today, and how do you propose those challenges can be addressed through research and legal changes?
So the great thing about being a health law scholar is that there is no end of great legal and policy challenges related to healthcare. Whether we're talking about how do we make healthcare more affordable, there's always going to be massive challenges around equity. Are all parts of the population receiving the care that they need when they need it? Is it, is our processes equitable? And so there's all kinds of things that happen. One of the things that I think, though, that is a really big field that we need to be looking at is the use of AI in medical care and the growth of healthcare data, and then who owns that data, how it's being used, and then also who it's being used by. So which corporations now have access to that data, how much power do they wield because of having it, and then how is that being used and interpreted by AI, and who's regulating that? And so I think the who's regulating that piece is exceptionally important, and we need to be thinking really broadly, both as a nation, but also internationally with other entities, about the kinds of regulations we might have and how AI might affect medical care, because it holds great promise, but there's also quite a lot of risk, I think, involved in it, especially as it's developed over time. The other big area that I think is really interesting in this space is the intersection of climate change and health, and sort of how decisions we make with respect to mitigating climate change and where we make investments in that space also drives significant healthcare outcomes and significant healthcare costs. And so I think being aware that we have to broaden out what we think of as health policy to things that are much more are significantly broader, like our climate change litigation. So I think that's another really interesting space.
You've talked a lot about the involvement you've had in all this and what you've seen through it. So what role do you believe that universities and academic researchers should play in shaping public policy?
Yeah, so I think one of the things that's been really great about being an academic who's trying to work in the policy space is that, especially in the United States, we see, every political choice has advocates on both sides. There are lobbyists, but everybody's kind of coming at it from a particular angle. And one of the things that I think is so important about universities and academic research in this space is that we don't have a dog in the fight, so to speak, right? We're coming at it from what is the research evidence telling us about what would promote healthcare the best. I'm not trying to make money off this. I'm telling you that I've spent my life looking at this, and this is what I think the best choices are to promote health or to improve affordability or to enhance, the provision of equitable healthcare. And so I think, and that has been very persuasive in the policy forums that I've been in, when you're speaking to congressmen or other legislators, or you're talking to a regulatory body, the fact that you're not trying to lobby them, it means that I think we bring more credibility to the table in that way. And so I think academics have a strong role to play in public policy, but they have to make sure that their work is very grounded, right? And that they are talking to communities and populations about the issues that matter most to them. It's not just sort of, I think from sitting here in this ivory tower, this is what I think about this issue, that they're actually really connected to what's happening on the ground. That makes their work much more accessible and usable.
Healthcare legislation on patient outcomes and healthcare system?
Yeah, so healthcare legislation in lots of ways sets out the structure of how we fund healthcare and how we fund it, but also the structures and the organizations that implement it. So when you think about, the Patient Protection and Affordable Care Act, the ACA, Obamacare, whatever you want to call it, in the US, that was a massive restructuring of the way that individuals in America access healthcare, how they receive health insurance, and it controlled, everything from the networks of providers that you get into to how the government paid for care. And so those are massive, massive changes that legislation can bring. But we also see, you also think of acts of, around the creation of Medicare and Medicaid and things like that can have massive change. But then you also have smaller legislation at state levels that are focused on what providers need to tell patients in terms of informed consent. And those can have incredible impacts on individual patients' lives. So there was an act in California that was looking at patients with breast cancer, and they found that certain providers who were really good at providing mastectomies would say, oh, I recommend you have a mastectomy. And other providers that were really good at doing lumpectomies, like very small surgeries, would say, I recommend you have a lumpectomy. But actually, it needed legislation to require providers to tell patients about both procedures and let the patient choose. And so sometimes physicians think they're doing the right thing, but it takes a legislative body to recognize where there's gaps in care and to step in and equalize care across the board. And so I think it can have incredible impacts on individual patients, but also massive system-wide impact also.
Oh, that's very cool. I just learned about some of those things recently in history class, so that's a big connection. What are the challenges of translating health research into effective public health policies?
There are many. Part of it is that, so if you start from the healthcare researcher side, a lot of times the research they do is very focused on health outcomes, and it's not necessarily driven in a way that would lend itself to public policy, right? So a lot of medical researchers are just looking at medical care, and they're not necessarily looking beyond that. So you've got to be able to have someone who understands policy and who understands medical research that can sort of say, oh, this is really fascinating research, and here's how you could turn this into effective policy and advocate for it. And so there is a real role for that person who can see and kind of translate. The other piece is that promoting health to the nth degree is not always every policymaker's dream, right? They have to balance a whole host of competing interests and competing lobbying interests. And so a lot of times figuring out what motivates different policymakers in a space and how to thread legislation through that's actually going to pass is the biggest challenge, right? You may convince policy, certain legislators that you're right, but what it would mean to actually get them to build sufficient consensus amongst their colleagues to get it passed, especially in the United States, is very, very challenging. We have especially, and this is especially true at the federal level where there's a lot of division. I think getting a policy all the way through Congress can be very, very challenging, especially if there are contested issues, at all in it. So I think those are some of the really big challenges in terms of, especially if you're trying to reduce cost in the healthcare system. Anytime you're reducing cost, you're also potentially reducing somebody else's paycheck. Or if you're cutting if you're improving efficiency, you're also potentially cutting other people's jobs. And so policymakers have to think on that broader scale about where they're going to allocate different kinds of resources and where they're going to use their political clout to move the needle. And so that sometimes means that great policy proposals don't always, make it into legislation.
Dr. King, you talked about how healthcare is expensive in many countries, and that's why we have all these problems with deciding how much things should cost.
So basically, I think the biggest issue with healthcare spending in the US in particular, healthcare spending is healthcare is really expensive across the board, but the US is paying sometimes 2 to 3 times what other nations are paying for the same goods and services. And a lot of that has to do with the policy choices that we make around healthcare. And so I think part of what is the biggest struggle for US healthcare being affordable is that we have a real commitment to markets and market function, and we have a real commitment. We can't decide whether we want healthcare to be a business or we want it to be a social service. And I think in the US, we tend to lean much more towards healthcare being a business where people want to make money. And that creates a real dichotomy or a challenge between how do we make sure people have the care that they need, so that they can go out and continue to be productive members of society and get what they need when other people are trying to make substantial amounts of money on the goods and services. And so sometimes that the ability to make lots of money in a healthcare setting creates great efficiencies and incentives, and it all works. But the reality is that in the most instances, the drive towards making money ends up being the more dominant force in the space. And so because we're not willing to constrain the ability very much to make money in healthcare, it means that Americans end up paying more for goods and services than they do in any other country around the world by a long shot. And so there is a decision: is healthcare an industry that we want to promote and we want to allow to make lots of money? And like I said before, it's lots of people's jobs, it's lots of people's pension, it's a huge portion of the economy. But it also means that the government then needs to also kind of step in and support and make sure that people get the care that they need. So really making that decision, I think, is the hardest piece. And then how do you rationally allocate goods and services that are necessary for all versus things that we feel like are more luxury items in healthcare, and how do you draw those lines? And that's always extremely difficult to do. But I think the biggest challenge is deciding whether healthcare is a money-making industry or it's.
Can you discuss a project where you had to integrate legal, policy, and health perspectives?
Yes. So really early on in my career, I was looking at, I think I referenced this earlier, I was looking at how patients made medical decisions and really thinking through the informed consent process and what doctors needed to tell patients as part of the informed consent process. And we found that doctors were inadvertently sort of steering patients in particular directions when the decision really should have been the patient's, that there was no clear, better medical choice. We call those preference sensitive conditions. And so we had to do that project, we had to look really broadly at how the risks and benefits of different kinds of procedures relating to different kinds of medical treatment and how doctors were providing that information. And then how informed consent law was requiring providers to do in that space and how much information and the guidelines around that. And so what we were able to find out was that, there was a real mismatch between what informed consent law was asking providers to do or requiring providers to do, what they were actually doing, and what patients really needed. And so as a result, I wrote a whole paper on this, looking, kind of outlining all these dichotomies. And then we wrote model legislation for how states could change their informed consent law to better give patients access to this broader set of information to help them really use their life experience and their preferences to make the medical choices that they wanted, and then to protect doctors and say, if you engage in this kind of process, if you engage in shared decision-making as part of your informed consent process, we will give you a broader set of legal protection from the claim that you didn't give the proper informed consent, or the procedure, the patient wasn't told about the particular risk of the procedure, because we know that we've seen in this process that you've given them all this different information. So it was a project where, and we actually got that legislation passed in Washington State. So it was a really exciting integration of law and medicine and ethics and sort of how patients go about making their choices and how physicians go about providing information to patients.
Okay, thank you so much. And what are some of the ethical considerations you take into account when doing your research?
So there's ethical parts, I think, in all of this, because you're really thinking about choices that will impact, people's lives in all different kinds of ways. So, everything from like distributive justice, how we allocate different kinds of healthcare, to personal autonomy, what should people be able to choose for themselves versus what can the government step in and control your ability to do. I mean, we see this a lot in reproductive decision making, and other choices that people make about their bodies in general and their sexuality, all of those spaces. So there's huge amounts about that. And then in terms of distributive justice, are we making sure that care is equitable? One of the things that's always really challenging when you're trying to develop legislation is, what are the externalities? What are the things that you're not thinking about? Because you're trying to put this legislation in with this particular goal. Are there a whole host of follow-on effects that are going to come up from this legislation that you haven't thought about or you didn't intend, that may create other inequities or other ethical issues or other incentives that you haven't thought of? So I think I'm always trying to make sure that the balance between the individual and the government is right, that the balance between sort of how we're rationing care, and if we're rationing care in a way that privileges one group in society over others, are we very consciously doing that and making sure that that's a group that should be have its interests elevated in this particular situation because it's not been elevated in others, and things like that. How do we really allocate care? So that's just a handful of them, but it has to come up in every instance pretty much.
Awesome. Thank you so much. And for my last question, one thing that I really wanted to ask was, I designed these interview questions based on what I know, but if there's anything you'd like to mention, or something that you haven't covered, or something you want people to know, please share anything you'd like to say.
Yeah. So I think what I would say is, I love that you're doing this project and that you're asking these kinds of questions. And my work has always been really interdisciplinary. And you had a question in there that was sort of like, what are the skills and experiences that you think are most valuable in this work? And I would say that having a really open mind and trying and not being afraid to ask the hard questions, not being afraid to go into places that you don't know about, right? And explore new fields, new areas of knowledge, and to be the only person in the room who really doesn't know. I think having those kinds of attitudes and being willing to engage with lots of different types of people and with a really open mind is the kind of key to how we're going to make progress on these larger challenges, in both related to healthcare, but also related more broadly. And so I think, just being willing to listen with an open mind to a wide variety of people with a wide variety of perspectives is the way that is probably the most important skill and the way that we're going to move forward. So keep on doing what you're doing.
Thank you so much. And Dr. King, I want to thank you again for this wonderful interview. And I also wanted to congratulate you and thank you, I guess, for all the great work you're doing.
Oh, that's lovely. Thank you for having me. It was really nice to be here.